It's really nice to be here with all of you and to have such a good partner in AAMVA, particularly on the drug driving issue. That was something that really came to my attention early on. And since that time, I believe that we partnered with a number of groups, but I think without question you're the strongest group to get the message out about drug driving and to really put it on everybody's radar and to do something about it. And I want to talk about that for a few minutes. But the other important part is, I mean, I couldn't, the timing to be here with my friends. Brian Ursino, to be here with John Batiste and to see the recognition that he so richly deserves is just particularly, it's a heartfelt time for me. And I'm always glad to be with the people that are on the front lines and doing the work in a host of ways. But the drug driving issue was one that probably a week into the office, so I've had the job about a little over 3 years, and Dr. Robert DuPont, who is very well known in really taking on the issues of marijuana, on legalization issues, drug driving, et cetera. He's just really a terrific individual who's a psychiatrist who's thought about these drug issues in this country a lot and has worked very hard to help remove some of the problems or help to bring attention to it. And he said, hey, are you familiar with the study that NHTSA had done, the roadside survey on drugged driving? And it was done in 2007. This was 2009. And I said, Dr. DuPont, I actually don't know about that study, but I'd love to learn more about it. The people at NHTSA, Jeff Michaels, the administrator, Dave Strickland, and so many others, they could not have been more forthcoming. They said, look, we're happy to tell you about it, explain it to you. We know that because it was the first time we tested for drugs, that we have a lot more to do and we have a lot more research. But I also said, well, I think it's really important that we get this message out, that we have this information and it be made more known to the public than perhaps what they know about now. Because frankly, the Mothers Against Drunk Driving and others and the great work that has been done on alcohol-impaired driving have really put that not only at the forefront of people's thoughts when it comes to prevention and dealing with the problem, but most importantly, we've really seen significant reductions for a whole host of reasons. Those same lessons learned on alcohol-impaired driving, those same lessons can be applied to drug driving. So it's really nice to be here with all of you, and you have been instrumental in bringing this to the forefront. Your conference theme of Move to a Better Tomorrow is one in which we can see some real substantive change in making our roads safer. And Americans really are familiar with the consequences of alcohol-impaired driving. They're really much more knowledgeable over these last few years about distracted driving. But working with the Department of Transportation and NHTSA and others has really been important to us. And so we took this issue on as one of our 3 signature issues. We put prevention programs, we put prescription drug issues, which actually tie in very well to the drug driving, and we put drug driving as a signature issue to deal with. The problem of drug driving, frankly, is more prevalent than many people realize. Certainly not the people in this room that know the information, but it really is very, very unknown in many ways by the general public. Well, let me tell you about the latest drug driving research, some projects that the administration has worked on in the past year, oftentimes with you as a partner, and what we can do in the future on this. So the data tells us in 2010 we saw the results of that first analysis of drug-related data from NHTSA on analyzing the FARS data. That nationwide census showed that 1 in 3 drivers killed in a motor vehicle crash in 2009 with a known drug tested positive for that illegal drug. And we know also that some states are much better at doing the testing and putting that type of effort into identifying the problem, particularly on the fatalities. Other states with their coroner and medical examination programs aren't as good at getting everyone tested. We think that the more tests that are done, the more the problem is going to be exposed. The further analysis of the FARS data suggests that the younger drivers appear to be especially affected by the dangers of drug driving. Under the age of 35, they represent almost half of the drug-involved fatally injured drivers, but they only represent 40% of all the fatally injured drivers. So the young drivers are the ones that are really susceptible also. Cannabinoids were reported in almost half, 43%, of fatally injured drivers aged 24 or younger who tested positive for drugs. And from the 2011 Monitoring the Future study, this might not be a study that you all are as familiar with, but for well over 30 years, they have surveyed, the University of Michigan has surveyed 8th, 10th, and 12th graders to get information about drug use from them. And so the survey instrument is really well done, and the knowledge that we learn from Monitoring the Future is really very helpful. Well, in that monitoring, the most recent 2011 Monitoring the Future survey, 1 in 8 high school seniors reported that in the 2 weeks prior to taking the survey interview that they had driven after smoking marijuana, and more than reported driving after consuming alcohol. And it's clear that drugs have that adverse effect in marijuana on judgment, motor skills, and reaction time, and the necessities for driving responsibly. We also know, by the way, from that Monitoring the Future study, that many young people do not perceive marijuana to be particularly dangerous. They would not be caught smoking a cigarette, smoking nicotine, but the more we have information that is given to them that marijuana is medicine, that it should be legalized, that it's more widely available, the more the message is that it's not that dangerous. And in fact, that message could not be more wrong. Well, to meet the President's goal of reducing by 10% the drug drivers on the road by 2015, we're working with a host of agencies. For certainly the federal partners, but more importantly, where the work gets done is at the state and local level. So your membership organization and the community groups that you all participate with are particularly important. President Obama in both 2010 and 2011 declared December National Impaired Driving Prevention Month and called on all Americans to commit to driving sober, drug-free, and without distractions. No handheld cell phones, no texting while driving. And in October 2011, the administration convened a national drug driving summit that brought together a wide coalition of stakeholders. Well, more than 40 diverse leaders from the government, from non-governmental organizations, and from the private sector all attended the event at the White House. And at this event, the Mothers Against Drunk Driving, the organization dedicated to ending drunk driving, announced an unprecedented partnership with ONDCP to raise public awareness regarding the consequences of drug driving. And we had worked very hard with our partners at MAD to have them participate with us and really help to get, because of the work that they've done, drug driving on everybody's radar. Well, every organization has a role to play in this, and we're here today because we're dedicated with you to improving road safety and saving lives. And it takes a lot of energy and a lot of dedication, and I commend you for that. And as with underage drinking, drug abuse, and other unsafe behaviors, well, the first step is going to be prevention. Prevention is really our most important tool, and AAMVA clearly recognizes the importance of reaching young people by supporting education in alcohol and drug abuse prevention, starting in elementary school. And our national youth anti-drug media campaign is called Above the Influence, and it's a brand that has released information about a drug driving toolkit to assist parents and community leaders with drug driving prevention. And over the coming year, we're going to expand that toolkit to give out even more information, because again, like a lot of other problems, drug driving, synthetic drugs, etc., isn't something that parents have much information about, and we want to give them the tools, because unlike what is often said, kids do listen to their parents, and the research is very clear. By the way, for those of you that have kids under 21, the research is also very clear that if you can keep them and they can keep from becoming involved in alcohol and drugs, that the chances of them ever having a problem with either of those substances is almost minimal, almost non-existent in fact. So if you have kids under 21, though, I'm not telling you to go lock them in the closet until, I mean, immediately say the drug, don't go home and say the drug czar said, look, I'm just going to have to keep you locked up until you're 21. Well, let me talk about a couple other things on this. We've made some real strides in both the United States but also internationally. We sponsored a resolution in Vienna for the United Nations on drugged driving, and we thought, you know, maybe we'll get 8 or 10 countries that will want to participate and be involved in this issue. And we had about 41 countries that all showed up and wanted to learn more, and we're also talking about some of the things they're doing. And we held the first international conference on drug driving. And I think some of you attended that in Montreal last year. And we know from the decades-long effort to reduce alcohol-impaired driving, well, we know that we are going to, again, apply some of those ideas, whether it's in education, technology, engineering, and prevention programs. And in education, we really look forward to the collaborations we already have with you. Information about the effects of drugs on driving is provided in driver's manual, and it's a good way to raise awareness. Many states currently have information about drugs and driving in their manuals, and we've been able to help. And if you need any information about this, we're happy to support you and work with you on that. In addition, some of the Department of Motor Vehicle websites, California, South Dakota, the District of Columbia, have specific information on their DMV websites about drugs and driving. Well, secondly, we need to pursue the legal responses to get the drug drivers off the road. And we strongly encourage states to pursue enhanced legal responses such as per se or zero tolerance laws that make it easier to keep drug drivers off the road. Colorado proposed a per se law. It lost by 1 vote just recently. So there's a lot of pushback sometimes at the state level, but once oftentimes you explain the value of a per se law, it can be quite helpful. 17 states have them, and we're happy to work with you or your state legislators or others to give them the information they need to make an informed decision. And to enhance law enforcement efforts in conjunction with NHTSA, we're developing the online A-Ride program. All of us know in law enforcement how difficult and expensive it is to get people into training programs, to take them off the street, particularly if it's a small agency. And so having more online programs, and having met with a number of DRE officers across the country, you know, they often say that, look, the problem is really much more prevalent than we think, but not as many officers are trained to do that initial recognition. And the A-Ride program, particularly if we can have it online, and we will, is going to be, I think, a very good program, including the development of reliable and widely available roadside tests. So having that type of information out there where an officer can have some piece of technology, or a trooper or a sheriff's deputy, to help them detect the drugs would be particularly good. So that's why we partnered with the Substance Abuse and Mental Health Services Administration to help set standards for oral fluid testing in the effort to expedite the development of roadside testing devices. And we think that once those standards are developed, many of the companies that produce different pieces of technology will be much more interested in producing these things for law enforcement. And ONDCP, along with NHTSA, is currently supporting the National Institute on Drug Abuse, NIDA. 90% of the drug treatment programs, 90% of the research on drug treatment is conducted here in the United States or paid for by the United States. So we really have a wealth, a data mine of information about what the research that works and doesn't work around drug prevention, drug treatment, et cetera. And we're partnering with them at the University of Iowa with a simulator. So they now have the DEA authorization for marijuana. They have the driving simulator system, and they'll be actually developing the standards that'll be very helpful in looking at marijuana use and drugged driving. And we'd like to see more and complete and consistent testing of the fatally injured drivers across all of the other states. In 2009, the state of Maine did not report any tests. Mississippi reported testing only about 2% of fatally injured drivers. Well, we know it's expensive, but we know that if we don't have the information, it's pretty difficult to tackle the problem. We've worked in the last year to reduce that drug driving through all of our efforts combined. I particularly want to thank you and the leadership at AAMVA for this. You know, we can't be satisfied until we really bring this to not only to the public's attention, but we also give the public and our officers and our law enforcement personnel the tools that they need to reduce drug driving. I can't thank you enough as a partner. I can't tell you how much I commend the work you do, but I really hope that because I spent most of my career at the local level, that you look at ONDCP, the Office of National Drug Control Policy, as a partner to help you. We're happy to give you information. We have a really dedicated staff of career people that know the drugs issue very, very well. They're very expert at education, information, etc. And so whatever we can do to be supportive of you and to bolster and your efforts, you can count on us to do that. Thank you all very much.